Hello and welcome back. We will today discuss one of the most important infections which can infect a baby, which is cytomegalovirus. And it is briefly called CMV, or because it belongs to the herpes family of viruses. So it's also called as HSV5. Okay. It's a DNA virus and it belongs to the herpes family. It's the most common infection, fetal infection in the developed world. Okay, it's one of the very important infections. Okay, you should know about. So, mostly it's asymptomatic in in people who are immunocompetent, and sometimes it can also cause mononucleosis like symptoms when people become immunocompromised. So the important thing is it can stay in latent phase, which means it stays just dormant, right? And once the immune system goes down, it can become reactivated. Okay, and it is more likely to then cause symptoms. Okay, so what are these mononucleosis like symptoms? They're just kind of generalized, like malaise, feeling unwell, maybe a sore throat, maybe enlarged tonsils, random headache, rash, or fever. Okay, so these are like generalized, these are very common symptoms, right? So, how is it transmitted? It may be by sexual transmission, there may be oral or sexual transmission, there it may be transfused by blood transfusion. So all blood banks, they screen for cytomegalovirus as well, apart from HIV and hepatitis B and C, okay? And malaria, of course, through tissue transplant, and of course through placenta vertical at birth or even by breastfeeding. So if a woman has active cytomegalovirus, not latent, she can shed it in her through breast milk. Okay. So cytomegalovirus is shed in bodily fluids of any previously infected person once reactivated. So once it is reactivated, it is not transmitted in the latent phase, in the dormant phase, it's not. Okay. And may be found in urine, saliva, blood, tears, semen, and breast milk. So, yeah, okay. So, how can it be prevented? At least sexually. So, use condoms and avoid infected partners. That's okay. So, maternal infection is subclinical in most of the cases, 90%. But as we said, sometimes it can cause flu like symptoms. Principal reservoir means the main reservoir, right? Main reservoir is actually a human. So, or it can be even a newborn baby if it's congenital infection. Okay, so like in toxoplasmosis, what was the principal reservoir? It was the cat. Okay, in cytomegalovirus, the principal reservoir is humans, including newborn babies. So the biggest risk is from babies who are infected in utero and are born with symptoms. So if they have symptoms at the time of birth, that makes a lot of difference. Okay, so they excrete cytomegalovirus for months through urine and respiratory tract, even 5 years or more. That means when these babies go to nurseries, they are a common source of infection, but they usually do not cause neonatal death. Okay. So if a is infected in uterus but no symptoms at the time of birth, then for the baby there is much lower risk of a permanent damage like hearing loss. So hearing loss is the most common complication. Sensory neural deafness is the most common complication in a baby who is infected with cytomegalovirus. Okay. Now, on ultrasound, how can we know it? The baby may have hydrops. Okay, so I know last year we discussed about this immune hydrops, which is related to blood incompatibility between the mother and the fetus, right? There are two main types of hydrops. First, how do we define hydrops? Fetal hydrops is actually like if there is accumulation of fluid in at least two of the body cavities. It can be even in the like ascites, like in the abdomen. It can be in the pleural effusion, for example. It can be under the skin, like generalized edema, right? So at least two cavities in the body. it can be life-threatening. It's a serious condition. Now, there are two types of fetal hydrops. One is immune, second one is non-immune. One is because of blood type incompatibility between the mother and the fetus. Okay, and mostly it's because of RH incompatibility. That's what we have done. Now, non-immune type is, it's there are a lot of reasons. Okay, non-immune type may be either because of a congenital anomaly in the baby, or it may be related to an infection, and it may be even because of a cytomegalovirus infection, or even you should know this one, viral infection, which I'm not going to talk in detail, but it's a very important infection in obstetrics gynae. That's called parvovirus B19, or it's also called slapped cheek infection, because they have a rash on the cheek. It looks like if the child has been slapped. Okay, so in non-immune hydrops, one of the important causes is cytomegalovirus, and that's why we are discussing it here. But there may be other genetic or chromosomal abnormalities, even Down syndrome. In some cases, it can cause hydrops, okay, congenital heart defects and metabolic disorders. Now, how does it present? The child or fetus on ultrasound can have microcephaly, a small skull. Brain anomalies are more common if infected in the first trimester. Child may have sensorineural deafness. So once the child is born, then we will come to know about it. Hepatosplenomegaly and thrombocytopenia. These are more common if infection occurs in late second trimester or third trimester. Chorioretinitis, so that's related to the eyes. Remember, that also happened in toxoplasmosis. IUGR baby, the baby may have jaundice, and that's why it is related to hepatomegaly. The baby may have skin rashes. On ultrasound, we may see echogenic bowel. Now, what does this echogenic bowel mean? Echogenic bowel is called a soft marker. It's even a soft marker for Down syndrome. It's not a diagnostic parameter. It's not normal. So what does echogenic means? It means the the intestines of the baby look very bright, like white. Okay, it should not be like that. Normal bowel does not look like that. If there is echogenic bowel, it may be even a Down syndrome, it may be cytomegalovirus infection. There may be something abnormal. We need to investigate more. There are other soft markers on ultrasound, like for example, choroid plexus cyst in the brain, or kidneys if there is pilectasis. So these are called soft markers. We need to investigate more. Okay. And intracranial calcifications, like in toxoplasmosis, but there is a difference, I'll tell you later, and sometimes inguinal hernia. Now, this is just kind of once a baby is born, they may have chorioretinitis, hepatomegaly, splenomegaly, elevated LFTs, IUGR, thrombocytopenia, hearing loss, which is sensorineural, microcephaly, ventriculomegaly, intracranial calcifications, periventricular leukomalacia. I'll talk about these two later. And there may be cerebral or cortical malformations. Okay. Now, how to investigate this condition? I will discuss that in the next part of the lecture.